On March 17th and 18th, 2010, an extraordinary gathering was held in Tegucigalpa, Honduras. More than 30 organizations joined forces for a mutual, vital goal: contraceptive security. The participants represented the wide spectrum of those with a stake in improving the reproductive health of Honduran women. NGOs such as social marketing organizations, clinical providers and women's organizations. Government agencies including drug control and health ministry officials. International donors and multilateral agencies. Commercial sector, manufacturers, distributors and retailers. Never before had these participants met to share ideas about how to work together. To tell you the truth, this is the first time that the commercial sector as such, and specifically in the area of condoms, is taking part in such an event. Funded by an Innovations Fund grant from the Reproductive Health Supplies Coalition, the event was part of an approach to improve the market for family planning called Total Market Initiative, or TMI. TMI Honduras was designed to increase coordination among those involved in the family planning market to address a troubling trend: slow growth in the contraceptive prevalence rate and rapidly rising unmet need, especially in rural areas. In Honduras, where more than half the population lives below the poverty line, the availability of safe and effective contraceptives for family planning is a matter of life and death.
Tratar de evitar muertes maternas. Tratar de evitar muertes infantiles.
What we are trying to do is avoid maternal deaths and avoid infant deaths. The idea is that the population can benefit from contraceptive choices that allows them to avoid those undesired pregnancies once they become couples.
Y esa es la razón por la que estamos hoy representantes de diferentes
The reason why we, representatives of different sectors, are here today is to benefit from sharing. The Total Market Initiative is precisely this, a process to coordinate the segmentation and the focus of strategies among different parties in the contraceptive market.
The TMI approach uses market information to better understand how effectively specific groups within the entire population of women of reproductive age are being served. Through research conducted by TMI's implementing partners, 4 market segments were identified. Each segment was characterized by shared demographic and psychosocial characteristics. Provided with this detailed information about the diverse needs and preferences of Honduran women, the workshop participants broke into 4 cross-sector groups. There, they could actively collaborate on how providers from each sector could best utilize their strengths to better serve their target population. The public sector, should they sell it at a token price or should they give it away?
Young women have fears. Their moms will find out as they get bigger.
Cómo se compra, cómo se almacena, cómo se distribuye, cómo se el consumo, cómo se organiza para poder después.
How do you buy it? How do you store it? How do you distribute it? That is what this strategy says. More than 15 strategies that were presented focused on such challenges as how to attract women with no ability to pay towards subsidized contraceptives.
Why has demand increased and need risen? From the viewpoint of the NGOs, we believe that information for clients is lacking.
All the sectors involved have to be open and willing to change. For the commercial sector, it is difficult. There are conflicting interests. But if there is a plan from the government, we will be integrated in an alliance. We propose as a strategy that we reactivate the Committee for the Prevention and Family Planning, and I take advantage of this opportunity to ask Deputy Minister Paz so that this request can become a reality. There was positive feedback by many attendees about the benefits of the experience.
Quiero comentarle que recibimos un cúmulo de información, sobre todo muy valiosa, que es...
I want to say we received a bundle of information, very valuable information that we need to do our job. From these, we learn of new niches that possibly we are not even tackling.
Sí, pienso que es muy importante porque todos tenemos conocer.
We all need to know what part of the market we can take advantage of. It was very interesting for me that people with less income are buying the product.
Menos pueden, están comprando el producto.
In her closing remarks, Vice Minister of Health, Miriam Paz, emphasized that the driver of better targeting of services for poor and rural women would be the newly reconvened Contraceptive Security Committee, or DAIA. As leader of the DAIA, the Vice Minister issued a passionate call to action to reinforce the momentum of TMI.
We know that we have a challenge, but challenges are good because they make us work harder every day. We have already made a commitment. We are going to gather together again in 1 month's time, and we should all participate. We should all get involved. If we love this country, it is necessary that we involve each other, that we get organized.